Bob, you want to come up too? I know you don't like to be in front of the camera, but Bob has done a magnificent job guiding us through this pandemic and through this crisis, and one of the people I'm extremely grateful for. We're here today because Miami residents shouldn't have to make a choice between the time it takes to get tested and their health. As of today, the city of Miami, in partnership with Impact Health, and we have one of the representatives who will speak in only a moment, is designating Miami Marine Stadium as a COVID testing site. If you feel sick and need to get tested, this is one of the best tools in our tool belt to help keep yourself and your loved ones safe and healthy. There are two options on how to schedule. Well, first of all, you can schedule the test, which can be scheduled through our website, through our social media, and through the city's social media. And the doctor will provide the actual link. And you can also, this is also a walk-up facility, so you can actually walk up and get tested as well. And then the third thing I would say that the doctor just mentioned to me is that this will eventually be a vaccination site. So if you want to get vaccinated eventually, it'll be turned on as a vaccination site. So I'm just going to say it in Spanish quickly, take some questions, and then let the commissioners and the doctor say a few words. I know Bob's not going to want to say anything, right? Buenas tardes, estamos aquí porque nuestros residentes no deben de tener que tomar la decisión sobre su salud o tener que preocuparse estar en una línea interminable para examinarse. Es por esto que hemos, junto con Impact Health, designado este estadio marino como un centro de pruebas de COVID-19. Este centro adicional tendrá sus puertas abiertas desde las 8 de la mañana hasta las 4 de la tarde. Se puede hacer una cita yendo a nuestras redes sociales de la ciudad y el mío personal, y me imagino que también los comisionados lo van a tener en sus redes. El doctor va a dar el sitio específico donde se pueden ponerse en el calendario, pero también va a ser un sitio en cual la gente puede venir sin cita para examinarse. Eventualmente se va a convertir en un sitio en cual también se puede vacunar, pero en el momento todavía no está disponible ese servicio, estará pronto. Así que para mí es importante que nuestros residentes tengan una opción. Hemos visto las líneas interminables en el condado y por eso estamos conjunto con el Departamento de Bomberos y Rescate, con los comisionados y con Impact Health y con nuestra administración, dándole otra opción a nuestros residentes para reducir el tiempo que ellos necesitan para poder examinarse. Gracias. Questions, English, Spanish? Carlos. Yeah. So apparently there was a technological glitch this morning. They rebooted a Microsoft server, and that has now been fixed. But I'm glad that the walk-up option was available and allowed you to get tested. Sure, I'll have the doctor provide that information for her. Glenna. No, this is for all residents. This is for all residents, for everyone. Yes. Well, there is nothing to say that that won't happen, right? I think the issue is we're expanding capacity overall, and I think that's the hope is that by expanding capacity, we are reducing overall the time that it takes for people to get tested. Anything else? I'm sorry. I'm not surprised. I think that that goes to show the need for testing, the amount of demand there is, and the precise reason why we're opening this facility today. Had we not opened it, imagine how much longer people would be waiting in other facilities. So I'm glad that we're able to do this. We have not. They have not discussed that with us. We're open to opening more sites, obviously. And we'll, if those conversations are had, we will make them public. Not yet. No. By the way, remember Marlins Park is tricky because we own this facility, so we can do it here. This facility has the capacity to have lines that are as long as, unfortunately, we're seeing. We don't technically. I mean, the commissioner and I can go into a long discussion about our rights on those parcels, which we're working on another issue with parks. But right now we don't have total control of the site, so it's not quite that simple. Sure. Yeah. Yeah. Yeah, exactly. Look, it's just as a Dr. Fauci question. Look, I think to your point, a lot of people are getting tested at home, and a lot of people are essentially following what are the CDC guidelines for how long they should quarantine. I know for a fact that there are multiple of people that have gotten Omicron beyond what's being tested and reported. It could be a significant multiple. So I think that what we're doing here is just giving people more of an ability to get tested if they want to get tested. Remember, a lot of people are also getting tested, Glenna, for work purposes, for travel purposes, and so a home test won't serve those needs. Yes. It's really hard to police that, right? I mean, what are we going to do? It's very hard. I mean, we ask people to use their best judgment without a doubt, because certainly, and by the way, if you're asymptomatic, do you really want to sit in a line for 3 hours to know that you're positive? I think there are people that are getting tested for a variety of reasons, right? That work maybe being one of them. I mean, they're making decisions not just on their own health, but on how it affects their interactions, and I think that's really important too, because they have elderlies in their, elderly people in their families, maybe people who are immunocompromised, and so it's not just about the individual, it's about how it affects other people. And I think that's another important component of the decision to get tested. And look, there's also discussions about the efficacy of rapids versus PCRs. I mean, everyone knows that PCRs are significantly more accurate, and they test for viral load as opposed to antigen load, and so there's that component of it as well. Thank you guys. Oh, thank you. Thank you. Thank you. Thank you. It came off great. Thank you. So my understanding is we're going to be reimbursed as well, but I can have yeah, I can have someone else address that, but that's my understanding. Thank you guys. I'm gonna let's see. We'll go in order of district commissioner 2, 3, 4. Is that okay? You guys okay with that?
That's fine with me.
Or 2, 4 in order of who got here first.
It doesn't matter. It doesn't matter.
All right, Commissioner Russell. Thank you.
Thank you, Mr. Mayor, and thank you everyone for covering this. Here in the city of Miami, we continue to believe that vigorous available testing is a crucial part of beating this pandemic. We believe that anyone who needs a test or wants a test should have access to a test and results as quickly as possible. And you're seeing Miami-Dade having a huge number of tests, more than anywhere else in the state, because we're a very dense urban population, and we see what's happening with Omicron. Right now, with the county seeing over 60,000 tests being performed a day, the city realized it's our job to step up and create a relief valve and help in any way we can. And our hope here is that the capacity will reach up to 2,000 tests a day if necessary, if people show up. We certainly have the logistics here on Virginia Key at Marine Stadium to do that. So it is real. The virus is still here. We need to take it very seriously. I spoke this morning with Carlos Migoya from Jackson, and hospitalizations involving COVID are now exceeding the peak of the surge from Delta. And so even though Omicron is less effective at putting you in the hospital, there are so many more infections of Omicron and it's spreading so quickly, we have to be vigilant. And testing is a key part of that. Because if you feel you might have it, you really should know so that you can let those know. You would change your behavior knowing that you have it, which might affect others. And so we do continue to believe that testing is very, very important. And I'm proud to be a part of this commission, this administration, to help provide whatever help we can. Thank you so much.
Well, as the mayor stated, everybody knows that there is a great demand for testing. And we have seen, and all of us, we have witnessed those long lines, and everybody has somebody or knows somebody that stayed about 3 or 4 hours in line. What we're doing here, we're trying to provide an additional site. And I want to inform you also that this is not the only site that we are looking into, so that a testing site will be established. We are working, every single district is working with Mr. Evia and with all the authorities to try to bring to their districts different sites, so we will have an abundance sites that will shorten the waiting period that everybody has to I will say that we have to withstand in order to be tested. And it is, in my opinion, it is our duty to provide as many sites as possible, because the demand is tremendous for different reasons. People, because some of them are afraid, some of them have to travel, or some of them have symptoms. It doesn't matter how much, how many times you try to convey the message that those people that they don't have symptoms shouldn't go and try to be tested, because you are taking the place of somebody that has symptoms. But I mean, you cannot police that who should be tested or not, just as the mayor said. So the only answer to that is to provide more testing sites, and that's what we are working on.
Good morning. This site that we have open today is not going to be the last that we're going to open in the city of Miami. Like many of you already have known, the city of Miami was a leader in opening sites when, again, 3 months ago, we opened up a site just like the one we're opening up here in Jose Marti Park in Little Havana. That site is being expanded to this one here, and it will be expanded most likely to 3 additional sites as quickly as we could put it together. We will be reimbursed for this totally with federal monies, so the city of Miami is not going to be in the hook for any dollars. There are problems with some of the testing, as you were asking, and part of the problem is that the vast majority of the 15 minutes tests, they come from mainland China, and like everything from the People's Republic, they're not too accurate, and we're dependent on them. So we have limited tests, not just in Miami and Florida, but in our whole country. So I would say to those that are out there that don't feel any symptoms, that they just want to take the test to see, hey, how do I feel today? Am I okay? You know, hold off unless you feel something, because we could run out of tests also. And at the same time, you're going to make the lines much worse for those that are feeling symptoms that might be COVID, might be a regular cold, or might be a combination of both. What maybe some of you in the media could go out there and try to find out for us, since we're not getting real information on this. When people get their results back, if they're positive, they don't know if it's the Delta or the Omicron. So when we talk about how quickly the Omicron is spreading, we don't have those real numbers. People might be able to judge based on how hard they got hit. The Delta was harder. So if you get hit harder, maybe you had Delta. If it's softer for you, maybe it's Omicron. And another question you might want to go out there and ask is, if you get the Delta now, how susceptible will you be to get Omicron, and how quickly could you possibly get it? So these are questions that we all need to have so we can inform the public as best we can. One additional question that was asked in Marlin Stadium: why haven't we opened it? Well, I'm going to tell you another reason besides what the mayor explained, and that is that we have Jose Marti Park open. That's more than sufficient for that whole area of Little Havana and beyond. We don't need two areas so close to each other. We have to spread them out within the city, and at the same time that we spread it out within the city, we're spreading it out so that others in other parts of our county and other cities, unincorporated Dade, can also come to our sites, because they will be open to anyone from Miami-Dade County and frankly South Florida to come. El día de hoy estamos anunciando la segunda operación en la ciudad de Miami para que las personas puedan venir y se tomen su test de COVID, además de poder ponerse las inyecciones para protegerse de COVID y más. Hace 3 meses la ciudad de Miami fue pionero cuando abrimos el Parque José Martí, y ahora estamos expandiendo, abriendo más lugares que se necesitan aquí, y esperamos que posiblemente lleguemos a 3 lugares adicionales por la ciudad de Miami. Me gustaría presentarle a alguien que ha estado trabajando con nosotros en la ciudad de Miami en los últimos 3 meses en el Parque José Martí, que ha sido la doctora en cargo de esto. Quizás algunos de ustedes se recuerdan de ella en conferencia de prensa que tuvimos meses pasados. I'd like to introduce to you the person that's been leading this charge in getting people tested for us, vaccinated, etc., in the city of Miami. And some of you might remember her from press conference that we had with her a couple of months back. But nonetheless, Doctor, you might be able to answer some of the questions that we can't, and maybe they might have others for you.
Thank you. Thank you, Commissioner. Good afternoon, everyone. My name is Dr. Oaks. On behalf of Impact Health, we want to thank the mayor and his team for allowing us to set up another site here at Marine Stadium just to offer the citizens of South Florida an alternate testing solution or a place to go and receive their vaccinations. We're currently able to scale to around 2,000 participants per day for testing purposes. We're offering antigen and PCR testing. We're finishing our infrastructure so we can be able to launch vaccinations within the next 48 hours. And at that time, we'll be able to offer Pfizer, Moderna, and J&J vaccinations for any eligible participants. You can go to our website at impacthealth.com/Miami Marine to make an appointment, but we also take walk-ups as well. We're here 7 days a week from 8 to 5. So we just want to basically give everybody an alternate place so that they can come and receive their COVID-19 testing or vaccination services all in one stop. We also hope to open up some additional sites just to help mitigate the wait times that we are seeing across the city. So all of these are things that we're working together as a team so we can help provide better solutions for all of citizens of South Florida. Walk-ups, you do not have to make an appointment. So the portal just allows you to go in and make an appointment, and hopefully as we can scale up, we did experience some technical difficulties this morning with an outage, but hopefully we'll be able to get the logistics running a lot smoother, open up more lanes to be able to serve more citizens. For PCR testing, 24 hours. Antigens, we can process your test once you're swabbed in 15 minutes. Yes. So because our system was down this morning due to that outage, we weren't able to input those results. So as the team inputs those results, you should be receiving a notification to your email that you registered with so that you can go in and check the portal.
So Commissioner Carollo raised some issues about Chinese-made tests. Is that this,
So we're seeing supply shortages everywhere. You know, we have to take into consideration that when you are dealing with antigen-based tests, that they're not as specific and sensitive as our PCR test, which is why we offer both here on site. So if you need a rapid antigen test, we can give you that option, and then you can wait. You can also receive your PCR, and then wait your 24 hours to receive that the confirmatory test.
Are those the Chinese-made tests that the commissioner was talking about?
So some of them are Chinese made, yes. Unfortunately, I don't have the specifics of which tests we are utilizing right now on site, but we do have Chinese made tests, and we also have tests that are made outside of China.
Do you have faith?
Bas-
Do you have faith in them? I mean, is that
Absolutely.
Yeah, basically, we are producing very little of the rapid tests in the U.S. We need to produce more. There are many companies in China that are so-so in the results. You have a few that are fairly good, but we have no choice but to grab what we can as a country. Otherwise, we won't have anywhere near enough. And the point that I was trying to make is that on our health, from here on, our country needs to be self-dependent. Whether it's masks, whether our gloves, whatever it is, for our health, and particularly so many of our medicines, we need to produce them in the U.S. so we never face a situation like this, that we're dependent on a foreign country and one not too friendly with us for the health of our whole country.
The city's website says you're using Abbott. I can't remember. Is that right?
So we have Abbott ID now, we have Binax now, we have CareStart, Quidel. We have multiple suppliers, so we try to offer the best solution with the quantities that we receive.
Covered like Abbott, that's rabbits.
Say that again?
That's rabbits.
So is Binax.
Binax, yeah, those are rapid.
Binax is also rapid. It's a different company.
Yes.
Dr. Pete, spell your first name and last name.
Spell my first name?
Yes.
Kristin, and last name is Oakes, Oakes. Yes, ma'am.
Okay.
Thank you, Doc.
Go ahead, Commissioner.
No,
Spanish.
déjeme decirle, varias personas vinieron y me pidieron que dijera en español lo que yo había dicho, que lo repitiera en español. Básicamente lo que estaba diciendo es que todos hemos sido testigos de la cantidad de tiempo que nos tenemos que pasar en línea, muchos de nuestros familiares y amigos, para poder obtener resultados o tener pasar por el test, ¿no? O hacerse la prueba. Y es nuestro deber como gobierno, pues aumentar la capacidad de prueba, y eso es lo que estamos haciendo para tratar por todos los medios de disminuir el tiempo de espera y la rapidez con la cual la persona puede ir y hacerse la prueba. Nosotros, muchas de las preguntas que se hicieron, y el alcalde fue muy explícito y muy claro en decir de que nosotros no podemos controlar la necesidad de la persona de ir a hacerse la prueba. Aunque no importa la cantidad de veces que digamos, si no tienes síntomas, no vayas a hacerte la prueba porque le quitas el lugar a una persona que tiene síntomas. Existe mucho temor y hay personas que se la hacen también por otros problemas o por otro motivo, como ir a viajar o porque tiene que ir al trabajo. Por lo tanto, la respuesta es aumentar el número de sitios donde se puedan ir a hacer la prueba. Y quiero anunciarle que este no es el único sitio que se va a abrir. Estamos trabajando en abrir sitios en otros lugares donde sea accesible a personas de esos barrios y de esas áreas de la ciudad de Miami y también del condado, porque no se le pueden decir que solamente las personas de la ciudad de Miami lo pueden utilizar, sino hacérselo más accesible al público, porque ese es nuestro deber como gobierno y eso es lo que estamos haciendo. Muchas gracias.
Thank you, guys. I appreciate it. Thank you for coming.